Sure. So the patella is what we call a sesamoid bone. So that means it's a little bone that sits within tendons and ligaments and basically helps those tendons and ligaments function as they should and do their job. So specifically, the patella sits in our quadriceps muscle mechanism. So our quadriceps muscle is that really big muscle that runs all the way down the front of our thigh, and the same as for dogs. And that mechanism comes from all the way up at the hip joint, all the way down the front of the thigh, and then ends up in a little ligament called the patella ligament. The patella sits within that ligament and should sit within a nice groove at the front of the knee. So at the bottom of the femur, the bottom of the thigh bone, there should be a nice groove that sits there. The patella should sit within that groove. And it helps the quadriceps to work as a kind of flexor of the stifle joint. So that's kind of what we want it to do, is to kind of flex and extend the stifle joint. If the patella is in the right position, it will do that. If the patella gets out of that position, then unfortunately we end up with problems. And so patellar luxation is when that kneecap, instead of sitting within that groove and doing its job appropriately, is able to jump in and out of the groove, or in worst case scenarios can get stuck outside of the groove completely. So I guess that's what it does, is the patella not being in the right place, and it can move either towards the inside of the joint, which is most common, or it can also sometimes move towards the outside of the joint, so-called a lateral patellar luxation.